Tricks against tics. Hello, this self-help video is for people who suffer from body-related impulse control disorders, also known as body-focused repetitive behaviors, or BFRBs for short. We would like to introduce you to some techniques that can help you better manage your problems and reduce unwanted behaviors. These behaviors include the compulsive pulling out of one's hair, for example, on the head, pubic area, or eyelashes. This is also called trichotillomania. Nail biting and biting the cuticles are also BFRBs. Biting one's lips, tongue, or oral mucosa, which is the mucous membrane lining the inside of the mouth, is another common impulse control disorder. Many people also tend to scratch or pick at pimples or blemishes on the skin. This is called skin picking. Body-focused repetitive behaviors often include a sensory component. For example, dry skin can encourage picking. A behavioral component, for example, automatic and ritualized behavior, and a psychological component, for example, stress, low self-esteem, perfectionism. This video teaches techniques for both the sensory and behavioral components. To address the third component, psychological problems or stress, we have developed the app Cogito, which you can get for free from the App Store. You can find more information about the app at the end of the video. BFRB can be focused, meaning it's an intentional behavior. Common triggers include itchy skin, perhaps a gray or annoying hair, or hangnails. However, for many people, the behavior has a life of its own and happens automatically. This means that the behavior is often performed without conscious awareness. BFRBs can lead to a number of other psychological and physical problems. Those affected may experience feelings of shame, leading them to withdraw from others due to, for example, bald patches on their head or unsightly fingernails. They may also avoid common social situations, like shaking hands. Skin picking in particular can leave scars, and compulsive nail biting may cause inflammation, which can impair nail growth. Pulling out one's hair can lead to problems with regrowth. However, simply knowing about these possible consequences is often not enough for many sufferers to kick their annoying habit. Many people feel they're at the mercy of their behaviors. This video will introduce you to 3 techniques that you can use on your own to reduce impulse control disorders. We'll go over the techniques one by one. The technique you choose to start with will be up to you. It's best to start with a technique that appeals to you the most. The important thing is to try the techniques one after the other, not at the same time. In illustrating the techniques, we focus mainly on hair pulling and nail biting, but these techniques can be very easily adapted, with a little imagination, to other problem areas. Before we describe the 3 techniques, it's important that you have a good understanding of the times and situations in which you tend to engage in the unwanted behavior. Observing, keeping a log of your unwanted behavior. Most people with impulse control disorders don't execute their behavior 24/7, but instead do so in specific situations, like when they're stressed, or while reading or answering emails, or when they're under the covers at night. Often, the behavior tends to occur at specific times of the day. With this in mind, carefully record your behavior for a few days. You can also ask those close to you to give you feedback about when you bite your nails, pull out your hair, pick at your skin, or perform other unwanted behaviors. Make yourself a chart similar to this example for skin picking. Record specific situations in the table, taking note of the time of day. Also indicate which problem behavior you engaged in. Don't actively intervene yet. Just try to observe your actions as neutrally as possible. Let's take a look at the various techniques. We'll start with habit reversal training. Many scientific studies have shown that this technique is very effective. The goal of habit reversal training is to replace the old automatic behavior with a rigid and incompatible response. In other words, the new behavior blocks the old behavior. Use the instructions that follow as a guide. This will help you to learn and easily apply the instructions to your own problem behavior. Through your behavioral observations recorded in your log, you'll likely have learned to be more aware of and attentive to your problem behavior. If you notice that you're picking, squeezing, scratching, biting, or tearing at your skin, or if you feel the urge to do so, then immediately interrupt it by switching to a fixed response. The new behavior could be, for example, clenching your hands into fists. It could also be effective to sit on your hands by moving them under your thighs while you're seated. Another possibility is clasping your hands together. If you tend to bite your mouth or lip, try pressing your tongue against the roof of your mouth. For best results, continue the new behavior for 1 to 3 minutes. The examples shown here are just suggestions. You may find that another behavior is more suitable for you. The important thing is that your new response should be as unobtrusive as possible and able to be sustained for 1 to 3 minutes. The more often you use the alternative behavior instead of the old problem behavior during your targeted times and situations, such as while watching TV, the more likely you'll learn to replace the unwanted behavior with the new response. This is particularly true if the behavior occurs at specific times of the day. Set a smartphone alarm to help you remember to practice. Forgetting to practice the exercises is often the biggest problem, even if you have firmly resolved to do so. This is where reminders can be useful. Let's move on now to the second approach, which is called decoupling. Decoupling has also proven to be effective, especially for nail biting and hair pulling. This technique is helpful in cases where the hands, teeth, or fingers are beyond your control and seemingly perform the behavior on their own, as if by magic. Decoupling consists of 2 steps during which the unwanted behavior is slowly replaced and unlearned. The old problem behavior is essentially overwritten and eventually unlearned. The decoupling approach works by mimicking and redirecting the old movements. The old behavioral pathway is changed so that it leads to a dead end. In this technique, you will start with your typical movement, but then divert it toward a new movement. The old problematic behavioral pattern will therefore become altered and remain incomplete because you will have ended the movement with a different action. Consider the following example before we go on in more detail later. When you have an urge to bite your nails, move the fingers toward your face, just as would happen when you actually bite your nails, but do not allow them to reach your mouth, but deflect them toward the ear just before contact. The fingernails still make contact, but not with your teeth. In this case, contact is made with the earlobe instead. Thus, the stimulus or behavioral urge involving the fingertips or fingers is satisfied, but in a way that doesn't result in injury. The new target movement should be performed with some tension and acceleration to ensure that the old behavioral routine, nail biting in this case, becomes conscious and can be diverted. Let's go! The important thing for decoupling to be effective is ensuring that the new replacement behavior is similar to the old behavior. This makes it easier to unlearn or redirect the old behavior. Let's look at a related example. If you're doing math out loud, you're more likely to be disturbed if another person is saying numbers in the background at the same time. If words are being recited in the background instead of out loud, it's much less disturbing. This is called interference. The more similar the interfering stimuli, the more effective they are. With regards to unlearning unwanted behavior, this means that the more similar the new behavioral pattern is to the old one, the easier it will be to disrupt and overwrite it. Since skin picking, trichotillomania, and nail biting are long-term ingrained behavior patterns, you will need to practice the new decoupled behavior several times a day with awareness and when in situations that typically promote your behavior. In order for the new behavior to prevail against the well-established harmful behavior, it has to be repeated often so that you can eventually recall it automatically. The new behavior sequence should be performed 10 times in a row each time you do it. Practice this at least 3 times a day. Ideally, set your smartphone's alarm, preferably for the times of day when you tend to actually perform the old behavior as noted in your log. Also practice during the critical situations noted in the protocol. We'll now describe how to use the technique for 2 impulse control disorders. The first example describes nail biting. Start by moving your fingers toward your mouth in a way that's characteristic of your nail biting. This might look like circling the fingers toward your mouth before biting. Everyone does it a little differently. The movement should first be toward your mouth, as if you were about to bite your nails. Just before reaching your mouth, purposefully deflect your fingers to another specific body part or simply push them away from you. Remember, it's important to perform the decoupling movement with a little tension and acceleration. It can also help to snap your fingers at the end of the movement. The accelerated movement will help you disrupt and eventually unlearn the old movement pattern. After completing the target movement, simply put your hands back in a neutral position. Initially, choose no more than 2 movement patterns, as the old behavior is most likely to be unlearned or overwritten when strong and similar movement patterns replace it. Also, it's best not to do the exercises in public, as others may perceive them as disturbing or odd. For trichotillomania, proceed in a similar way. First, guide your fingers toward your head in a way that's characteristic of your hair pulling. Just before reaching the target, direct your fingers toward your neck, ear, nose, or some other specific point with an accelerated movement. Flicking your hands forward can also be effective. As noted above, this accelerated movement helps you to disrupt and eventually unlearn the old movement pattern. Again, choose no more than 2 new movement patterns at first. You can also divert your hand to massage your neck, but of course without pulling hair. This exercise can also be performed in public without generating attention. Particularly for nail biting, but also for trichotillomania, rubbing your fingernails on the soft parts of the palm of your other hand or on the tip of your thumb on the same hand has also proven effective. Your nails or fingertips should touch your palm or thumb at a 90-degree angle. Don't push the skin under your nails or apply pressure. Use light movements like a massage. The third method is a variant of decoupling. Decoupling in sensu. In sensu means in the imagination. This is different from the first 2 methods suggested above because you do the first part of the exercises only in your mind or imagination. At the moment when the unwanted behavior is about to occur in your imagination, for example, biting your nail or pulling out a hair, you actually move your hand, which you were imagining moving toward your head, forcefully forward and spread your fingers. Only the second part of the exercise, the moving of the hand and the spreading of your fingers, is visible. In the insensu method, it's necessary to practice the new uncoupled behavior with awareness several times a day and during situations when you would typically perform the unwanted behavior. Perform the new behavior sequence 10 times in a row for at least 3 minutes each time. Practice several times a day. It's best to set a smartphone alarm to help you remember to practice. Since this procedure is very similar to decoupling, we'll only illustrate the technique for nail biting. This technique can be easily adapted for other body-focused repetitive behaviors. If possible, go to the place where you frequently perform the behavior or put yourself in a situation that frequently triggers the behavior, such as watching TV. Your arm should be slightly angled. Now imagine your fingers moving toward your face in a way that's characteristic of your nail biting. Immediately before reaching the target, forcefully push your hand, which you were previously only imagining, away from you in reality, and spread your fingers at the end of the movement. There's one small difference between the decoupling techniques to take note of. In the first decoupling technique, the arm is completely stretched out during the movement. In the decoupling in sensu technique, the forearm is slightly angled and eventually stretched out so that it is parallel to the floor. Try it out and also experiment with other movements. The accelerated movement here helps to disrupt and eventually overwrite the old movement pattern. After completing the jerky target movement, simply return your hands to the neutral position on your thighs. Practice this for a bit. Perform the new sudden movement exactly the same way each time, because the old behavior pattern is more likely to be broken when a strong alternative pattern takes its place. You can use essentially the same technique for skin picking and hair pulling. But wait a minute! The methods presented here may seem to be literally replacing one bad behavior with another. It's true that one behavior is being substituted for another, but the big difference is that the new behavior won't result in any negative consequences. There are no skin injuries, missing hair, or jagged fingernails or cuticles. Finally, please note the following. Do not bite your nails, not even if a nail is broken or damaged. Use a nail file instead. Similarly, do not pop pimples and do not pull out gray or split hairs. Those suffering from trichotillomania should likewise not pull any gray or split hairs. Even if behaviors such as this are justifiable and well-intentioned, it may cause you to resume your old behavioral pattern. We recommend that you always have some lotion on hand, particularly if you pick your skin, or a nail file if you tend to bite your nails. Also note that bitter substances available at pharmacies can support the techniques presented here to prevent nail biting. Occasional slips aren't the end of the world. The first step is to reduce the undesired behavior. You have already gained much if you do the old behavior less frequently. However, don't consciously allow yourself to bite a few fingernails, pull a few hairs, or pick a small piece of skin. One incident of doing the old behavior doesn't necessarily indicate a relapse. You should continue to practice even after you've significantly reduced the old behavior. It's best to practice at specific times and/or whenever the urge sets in. The new behavior must become second nature, like tying your shoes. New behaviors need time to take hold. You will most likely see an effect if you consistently apply the method you've chosen on a daily basis. Keep in mind that the presented techniques are recommendations. They are not recipes that work only as shown and not in any other way. If you find that you're not making progress on your own despite consistent practice, we recommend that you consider psychotherapy. Here's the link for Cogito, a free app without advertising for improving self-esteem and overall mental health. Its effectiveness has been confirmed in 2 controlled studies.